It's time for another Valley Health Check with our friends from Horizon Health. You can always find numerous topics, numerous conversations, and it can be very helpful for you and your family. Just go to mymixfm.com, check out our MixFM app, and you can always go to myhorizonhealth.org and get information on all the great medical professionals, learn about Aaron and how fantastic he is, and all the great folks over there. I know, it's an early birthday present. But we're here today with another topic, another great person to introduce to you. And Aaron, I think we're going to get us started.
Yeah, today I'm very pleased to have with me Emilee Campbell. Emilee is our staff radiology manager at Horizon Health and a multi-specialty tech herself. I was worried I wasn't going to be able to say that without twisting my tongue.
You didn't have to buy a vowel or anything. That's awesome. Emilee, a pleasure to meet you. This is your
pleasure.
First podcast with us.
Yeah. So I've been a part of the Horizon Health team consecutively for about 9 years. Aaron said I'm a multi-specialty modality tech, so I do X-ray, CT, and MRI, and now I'm in the management role. So,
wow.
Yeah.
You're busy. That's what that tells me.
Yes.
We're busy.
Very much so.
We're busy. So just a second here. You do X-ray, CT, and MRI.
Correct.
Okay. And then what are the other modalities we offer?
So we also offer ultrasound, nuclear medicine, mammo, and fluoro, which kind of goes in with X-ray as well.
That's a lot.
That's a lot of extensive
Pretty
Yeah.
comprehensive. Pretty comprehensive. We do all kinds of fancy studies. Of course, that's at the main hospital in Paris. So, okay, department overview. Check. Thank you very much for that. So, also radiologist on staff.
Yes, we do have Dr. Houle. He's the best. He is what we love to call him, the unicorn. And he is a
gifted
great
man.
asset to our team. For sure.
Well, that's awesome.
So something different for critical access too, especially, local.
Yeah.
Not very many have radiologists on site anymore. So that's something that we can really hone in on.
And not to, you guys are here, so I'm going to talk great things about you. But you notice all those great things that are available for you at Horizon Health here locally that maybe someone else doesn't have. Or, I talk about this on most of the podcast. I'm so impressed with the medical professionals there, but all the things that they do is very beneficial to the patient or anybody that's going to see you guys.
Yeah, we talk about it a lot, feel a little bit like a broken record, but it's just one of those things where I always encourage people to check.
Yeah.
We have grown so much over the last few years. Sometimes I have to check. Hang on a minute.
Yeah.
I need to see, do we do that?
That's a
My
wonderful
doctor says
problem.
I need X. Do we do that there? So often the answer is yes.
Yes.
So anyway, I didn't mean to go sideways. What are we talking about today?
I think I did that. So
I was like, well, give us the rundown on the whole department since you're here. You should get to talk about all the things.
So we're going to talk a little bit about scans, but more particularly coronary calcium scan. Now, I read that. I'm like, I have no clue what that is.
Sounds like it's milk.
It sounds like something that's in my cereal
Calcium,
that I should either stay away from or get more of.
Right. Right. Okay, so in this context, calcium is...
This would be hard plaque in the arteries of the heart.
Oh, that does not sound good.
So it's not milk.
I don't want any.
Not milk.
And it's not good for you.
Okay, I don't want any. Thanks.
No.
Yeah. So, okay. So we're measuring, there's a scan that measures that.
That's correct. So it's a CT scan. So you get hooked up, you come in. You don't have to have an order. You can have an order to come in and see us, or you can walk right in the door and say, hey, I want to do a CT calcium score today. And it's a cash price of $49 up front.
That seems reasonable.
So reasonable.
I mean,
$49 to come in and essentially check, parts of your body that need to be checked.
You can't go to a movie for that with a date. And this could be life-saving. I mean, am I wrong?
No, you're not.
I've never thought about it. We should probably stand outside the movie theater and point that out.
No diss to the movie theater business.
We should
but to give you perspective, a date night out would cost more than something that could literally save your life. I don't mean to be over dramatic.
No, it's not, because we have the proof in the pudding where we've done these types of screening tests, and the following week you've got people going to see interventional cardiology and things to get stents or do the workup to make sure that they're being managed correctly, to make sure it doesn't go anywhere, or, keep that eye on it.
That's crazy. So $49, let me clarify. An order is what, when a provider tells you to go get a test.
Okay, that was my next question.
Yes.
Yeah, essentially.
And so this, you don't have to have a physician or a nurse practitioner or a PA. You don't have to have anybody tell you need this.
Right.
You can just, as a human, be like, hey, I want to check on my health, and walk in and request the test.
Most of the time you need to be referred.
Right. Yes.
or set that up for you. But
this is one of those once-in-a-lifetime things right now, if you will, where you don't have to. Now, maybe one day, 10 years from now, it may be a different story. But right now, there's no regulation that says that we absolutely have to have an order to do anything. We recommend it for the fact that because we have Dr. Houle and he is so good to us, Dr. Houle actually does a full, extensive interpretation over the tests, looking for not only the things in the heart, but outside of the heart. So looking at lung tissue, looking breast tissue, anything out in the soft tissue of the chest in the area of the heart that we scan.
Why would somebody want to do this? Would it be because they're aging, or is this for a certain demographic that's most important for?
I think it's really for anybody that has a current smoker, previous smokers, your age range, you hit 50. 50 seems to be that magical number,
Yep.
But you hit that age range of 50 to 75 where, you need that screening health care just to see where you're at because you've hit that point in your life, unfortunately. Yeah. But for $49, you get hooked up to the scanner, EKG.
Does it hurt in and or out? Anything?
Nothing. We scan you real quick. It's about a 10-minute test.
Wow.
Yeah.
With preliminary results that day.
My glass is half full some days. Some days it's half empty and there's a hole in the bottom. Let's say you get this done and the calcium buildup is atrocious. Is that right? Did I say that correctly? The calcium buildup, that's not right.
That's one way to put it. But
it's not wrong.
No.
It's the problem. There's too much there. Is that scary? I mean, what do you do at that point?
So tell us a little bit about how it's scored.
Okay. Yeah, I jumped ahead there.
Yeah.
That's okay. That's okay. So once the scan's completed, it actually goes into a post-processing system where a technologist will sit down and review the main arteries of the heart, and they will pinpoint what they see from there. And then as the number gets higher and higher, it also depends on your age and your sex and all the other things too. And it kind of puts you in a different category depending on what that score is and then your risk factors of everything else.
Can you get better from this? Or is it, well, it looks bad. Sorry, see you later.
There is some intervention that can help with that. There's medication interventions. There's the stenting interventions that they have.
That's what I was...
That kind of stuff. It just depends.
So nothing should deter you. If this is something you feel you need to do, you should do it.
Absolutely not. If you feel like this could really benefit you, there's nothing that says you shouldn't.
I can't see why it wouldn't.
Yeah.
Yeah. So a couple clarifying things. One, just because your physician or your provider doesn't have to order it doesn't mean that they might not, right?
Right, true.
So when we talk about our healthcare is driven usually by three factors, right? It's driven by us, the patient, it's driven by our medical provider, and it's also driven by insurance.
So there you go. That's the big question there.
So, you have to have a cause to get a diagnostic scan of this type. So insurance isn't going to pay for a scan of this nature or a scan to look at these things unless there's something going on. Some of our providers are big fans of the heart scan, and they encourage it if patients have a certain risk factor or if they have a certain age. It's a little bit of a workaround for the insurance that we all love so dearly.
I like to put myself into the situation to try to understand it. And I think of myself talking to my primary about this. I could so see her going, yes, I think you should.
Right.
I mean, why wouldn't you? Right. But I guarantee, I'm not a gambling woman, but she would say that.
Right. Right. Or your primary might say, well, Kevin, you don't really have any risk factors. So I'm not saying I don't know.
I don't even, risk factors.
I can't even stand here and regurgitate.
I'm standing up right now.
Looks a lot like Santa's list, my risk factors.
I would like a scan for Christmas.
I guess my point is your provider may say that too. Well, I didn't bring it up because I don't feel like you have any risk factors,
right.
But you don't have to have my blessing, candidly, and it is only $49. So those are the type of conversations. Obviously, talking about it with your provider is encouraged. The other thing where I think we want to talk about the provider a little bit is the results. So talk a little bit about how those results go back to the patient.
So I think something that's a little bit different with us compared to other entities around us is we do have Dr. Houle, the radiologist, look over these tests. So not only do you walk away with a preliminary result that day from the post-processing and the actual calculation of the calcium, if there is any, but also a radiologist is overlooking that score, overlooking those arteries, overlooking the lung tissue and everything else with it.
Very extensive.
To make make sure that, there's nothing like what we would call like an incidental finding.
You get a lot for your $49.
That's right. That's the whole point. Full circle. That's what we're doing here, right?
That's awesome. That's all kidding aside. That's a resource that can be so beneficial for so many.
Well, and so, you asked about what you can do. And that would be next steps, right? Emilee went into some of the options. If it's going to be cath lab, it's going to be whatever. But the point is you now know, right? You now know what you're dealing with. So whether that referral is, whether you're taking it back to your PCP, whether you need a cardiology consult, whether there's a red flag result, I presume you have some of those too.
Yep.
What happens to those patients?
So the cool thing is too, with if you say you walk in the door and you're just like, hey, I want to do this today. Provider hasn't wrote you an order, no big deal. At Horizon Health, we work with our cardiology team, and they take on the patients that just walk in the door that say, hey, I want to have this done today. And we make sure that you're aware of all of that. Like, hey, we're going to send this to our cardiology team. They're going to reach out to you. So then from there, our cardiology team, takes that result. If you have that red flag that comes up, that's not necessarily anything related to your heart, but they also take that, make you aware of it, and try to push you on to that next step, whether you go back to primary care, whether you go to the next level of something else.
That's called a great team right there.
That's right.
That's awesome.
Teamwork makes the dream work.
And that's why I love these segments, because people probably have never heard of it. You're learning about this and you can see the benefits of having this done. And if you're worried, or if you think you're past smoking, or you have heart disease, or there's issues in your family, I could sure you'd be leery about doing it. You might, but you got to do it to get better. And find out where you're at.
And it's so easy. It's so much more convenient now with the technology that we have, where it's not 30 to 45 minutes on a table. You're in and out in 20 minutes.
That's pretty impressive, actually, for a scan of that nature. Now, can people come back? Hey, I think I need another scan a little later. Is that weird, or is that normal?
That's a big question I had, too. If you look at this as, oh, man, I'm 50, or whatever the magical number where you're starting to get a little more engaged and starting to do some of the preventative screening tests, and it does come back good, then what? When do I pencil it in again?
5 years?
Or should I? Yeah.
I would say this is one of those that you could pencil it in every year if you really wanted to.
I was going to go a year. I was thinking a year sounded good.
If you really wanted to, you could. And it all depends on your factors. Like if you have that history or anything like that, it's really great, because all of our technology, we're not giving as much radiation dose and all of the things that we used to. So to put that on your calendar, hey, 365 days from now, I'm going to go ahead and hit another one. Totally worth it.
Yeah.
In my opinion.
That's something I'd like to spend just a second on when you talk about that dosing, the radiology dosing, or the exposure to the radiology machine, equipment, rays, whatever the right word is. I don't know.
You're on it.
It used to be that it was very, very, very concerning to have somebody that has too much imaging or too much exposure to X-ray or CT or the modalities. Talk a little bit about how that's changed and why procedures like this that are elective are permitted, why they're safe.
So, just even within the last 9 years that I've been working, that dynamic has completely changed. We were very cognizant of, well, you've had this and now you've had this, and we're just kind of adding to it. Oh, you've hit the ER. Now we're hitting emergency surgery, all the different things. The really cool thing about how technology has just taken over, and even our government getting involved with dose management and radiation exposure, making sure that our machines are equipped to not be excessive. We have all of the right tools to make sure that we are not going to overexpose you by any means. So if you have those screening tests every year, it's not going to affect you in the long run like how we used to think it would. So it's totally worth it.
I love how technology is really catching up for the benefit of medicine in so many ways.
Absolutely. Right? And imaging, I would say, is definitely one of those for sure. Just from when I started, the game has totally changed.
Even the Grinch, the heart is too sizes too small.
Yeah, well,
get a picture.
I'm thinking of all the X-ray films. We haven't. There hasn't been
a Polaroid picture.
Yeah, there hasn't been film in years and years and years.
I think of like a.
Exactly.
Like changing your transmission or something.
Yeah. Well, and I remember when the low dose stuff started. I remember when we went and started updating our equipment. That's been, probably 8 or 9 years ago now. And one of the big things that changed too is that your dosing is now dependent on your size, right?
Yes.
The equipment is now smart enough that it only doses you with what you need based on your size. So a kid's no longer getting the same dose as a 300-pound man.
I think.
Yeah. So the safety component has come a long way there, and therefore we can offer stuff like this. In closing, I think we've talked a lot about if you have risk factors, if you have risk factors. I'm not sure that we've defined them. So let's go through real quick. What would we consider people who are at increased risk relative to their cardiac health? So going through here, this list, help me out here, Emilee.
So we're looking at the population. This recommends 35 to 70. And I guess that would also depend on if you're a smoker, past or present, any history of high cholesterol, diabetes, high blood pressure, those who are overweight, those who don't live the active lifestyle that we probably all should in one way or another. But those are the people, even in the younger populations, we need to start looking at now.
So if you hit that trifecta, you probably more than one on that list, 2 or maybe even 3. That's possible.
Absolutely.
No reason not to.
All right. Well, I think we've learned a lot today. I think this scan is very interesting. Coronary calcium scan. If you know someone in your family that could benefit from this knowledge, it's so easy to forward these podcasts. You can download them. You can send them. You can listen together. It's really helpful. And there's a slew of them up at mymixfm.com. Check this out. It's with our friends at Horizon Health. Emilee, your very first podcast. You did great. Thank you so much.
Thank you.
Awesome. We got to get her a T-shirt and some Tupperware. So good. It's so good.
Kevin makes big promises.
I know, and I never fulfill them. But I might get this heart scan. Go to myhorizonhealth.org to see these wonderful medical professionals and learn more about those guys. MyMixFM.com and our MixFM app. This has been Valley Health Check. Thanks, ladies.
Thanks, Kevin.
You.